Hi, my name is Phil. I like to talk about politics. In this video, I'd like to discuss the figures which show that Britain's National Health Service is being rapidly weakened by the government in a way that is seriously endangering the lives of UK citizens. But first, if you'd like to receive notifications of upcoming videos, then please subscribe to the channel and click the bell icon. So, figures have been released this week that show hospital performance in England is at its lowest since records began. The reason will come as no surprise to anyone who pays attention to NHS performance. The Conservatives carry out a regular grotesque charade of pretending that they believe in the NHS and that they are increasing funding and they are the people to make it get stronger, and how they're going to attract more doctors and nurses, but it's a complete sham. Take the promise of more medics in the NHS, for example. So Boris Johnson has promised to recruit more doctors and nurses, if people are silly enough to vote Conservative next month, that is. He knows it's a powerful campaigning tool, the NHS. He got them to vote for Brexit on the back of a promise of more funding for the NHS, which has since been shown to be a lie. But those same people who understand that his bus claim was a lie, they accept that now, may still believe this latest promise. In fact, it seems that many do. And it's the same promise that Theresa May made and that David Cameron made before her. They all talked up in the general elections about, oh, it was going to be so easy to get a doctor. Whenever you liked. Could just wander in on a Saturday and see a doctor. Brilliant, marvellous. Never happened. And not only didn't it happen, it's actually getting harder and harder. It's not that they didn't give us the better service that they promised. It's got worse. You know, the Conservatives in government have never recruited enough medics to meet the demands. In fact, the Health Secretary, Matt Hancock, is quite funny. He was recently saying, oh yeah, how hard it was to get an appointment with a doctor. This is after 2 general elections that have returned his party into government where they promised that that wouldn't be an issue, that there would be enough doctors. And now it's even harder. It isn't even a case of money as such, which is a little bit lacking. Yeah, the government are not keen to provide money to public services. You know, they're dissuading doctors from even coming to the UK and working in the NHS. Many who already were have left due to either the unpleasant rise in racism after the Brexit referendum or just because of the uncertainty of their rights after Brexit. In fact, we've lost some because of problems with getting settled status. How mad is that when you're short of doctors and nurses, that we're not even giving them an easy time of making it clear that yes, we do want you in the country. We'll absolutely fast track on and guarantee settled status for anyone that can do these key jobs. So and the effects now of undermining the NHS in this way have become obvious. You can't deny them. The government can't even deny them. They just say they're going to make it better. They can't say... They don't say, oh, look at our 10 years in record to judge us by. That's what they should be doing. A government that's been in government for about 10 years, like 9.5 years now, should be able at this point to say, look at our record. You look at how we've done over the last 9.5 years. Yeah, we're the ones to vote for again. They don't do that. They daren't do that. You know, figures are showing that the target for wait times in A&E, for example, accident and emergency, have been missed again. But it's yet again. The targets were set at 98% to be seen within 4 hours during the last Labour government in 2004. And they worked on that and they were meeting those targets. You know, and you know, 98%, in excess of 98% were being seen within 4 hours until the Conservatives came to power in 2010. And what was the first thing they did? This is a party we're supposed to believe have got the NHS best interests at heart, our health at heart. So what did they do in the interest of maintaining these standards in the NHS? They instantly dropped the target from Labour's 98% to 95%. Why? Because they were, and they did this immediately. You know, they came to power in May and they did this in July, 2 months later, but that in you know, operational terms, that's immediately. And it's because they were clear in the knowledge. They understood that they were going to ravage our public services and it was going to make it impossible to meet the targets that Labour had set and met. So they dropped the standards in order to make it easier to hit those targets. And then promptly fail to even meet those lower targets. And if you look at this graph, you can see the seasonal nature of the problem. So Johnson has taken us to the polls just in time from his point of view. Any later, and those elderly voters that he relies on so much will be feeling the full effects of massive wait times, cancelled appointments and cancelled surgeries as the winter stresses on the NHS become too much. Over 3 years since they've met even their reduced target for wait times over a nearly 10-year period. And Boris Johnson is seriously trying to tell us that the NHS is safer in his hands than in Labour's. And it should be noted that they have never once met the target that Labour set since coming to power. They have a couple of times met their own lower target. They've never met Labour's, and they haven't very often met their own. And that's just the wait times in A&E. Targets have also been missed at all levels of hospital care, including cancer treatment, with the obvious risk to life that poses, delaying cancer treatment, for goodness sake. And the reason that there's so much emphasis on AOE times is because it's considered a barometer for the whole health service. That's because the A&E struggles when other departments are struggling that feed into it, because everything feeds into it. So whenever there's a problem anywhere, it's noticeable in A&E. For example, if there are no beds on the wards, you can't admit the patient, so they stay in A&E. You know, if there are problems getting care outside of hospitals where you should be able to get it, you know, problems with social services funding being cut, people go to A&E. So there'll be people who go to A&E that shouldn't really need to, but where they should be going isn't available. So again, you sort of see the general health of the healthcare system by what's happening in A&E. And you just have to look how far off their own targets the government have been. And it's sustained, and it's a downward trend. This means that it will absolutely get worse year on year. How could it not? You would have to be crazy to think that the Conservatives will improve the health service when you look at this. Not only will they not improve it, they will not even maintain the same piss poor standards it has now. They will promise the earth. When it comes to the NHS, they will promise the earth for the elections and then afterwards tell you that the earth that they mentioned was actually your grave. It's a sobering thought to consider that if Boris Johnson does win his majority next month, there will be people voting for him, quite a lot of people, who will die this winter due to the party that they are voting for, that otherwise would not, where they would have survived had there been a Labour government instead. And when you consider the proportion of elderly people that vote Tory, and that sadly die due to insufficient care with the current regime, it just seems statistically certain. The number of people who suffer what are termed excessive winter deaths runs into the tens of thousands each year. And it's not something you compare one year with another. Let's not do that. Obviously, some winters are worse than others. I think 2017 was a very, very bad one. There was also issues with the flu vaccine not working. So depending on weather and certain factors, some winters can be worse than others. But when you sort of look at it over a long period of time, the greater factor is clearly the care the government show. So this is what it looked like over a period of years, with the trough in the middle being the last Labour government, flanked by the rather larger spikes of the prior and current Conservative governments. So what's the plan for the Conservatives in the next Parliament? Well, what would you do if you didn't really care about what the targets represented? You didn't actually care if people got better, but you wanted to look like you were meeting your targets. That's right, you'd lower the targets. That's what Theresa May did in 2017. They lowered the target from 95% to 90% and also failed to meet that. It was supposed to be part of a plan with milestones used to get it back on track. But it failed hard, and that's because there was no plan for it. Just a vague idea to lower the targets before raising them back up again, as if setting targets on its own fixes the problem. So not only are these Conservative governments not competent enough to meet targets, they're not even competent enough to set targets that they will meet. Consider what that means. If they deliberately set a target to allow them to undermine the health service but still look like targets have been met, and they still fail them, that means that they are performing even more badly than they are planning for. It means they don't actually understand the consequences of their actions to the fullest extent. You are literally seeing the Conservative Party trying to do damage to the health service hiding the evidence behind lower targets, and still being caught out because they caused even more damage than they intended. What's the betting that Boris Johnson will just lower the target to 0% to make absolutely sure that he can then claim on television interviews that hospitals are exceeding their targets every time, every hospital, ever since I became Prime Minister? I exaggerate a little, but I am quite sure that they will lower the target again. That will be imminent, as will the collapse of the entire system be. So there we go. I hope you found that interesting. If you'd like to support the channel further, then please click on the Patreon link for details. And until next time, I'll see you later.